So in this video, I want to discuss some of the structures you can see on the liver models. There are three generally that we discuss. They can be taken down and examined closely. And this is one in which you may have seen in class, a fairly large liver model. It does a good job of showing a few things. One in which does an excellent job all around is the one from your torso models. On the liver, we discussed it having two lobes in the front, 2 lobes in the back, 4 liver lobes. As I flip it around here, it's a little easier to see these lobes together. We have the much larger right lobe of the liver, the smaller left lobe of the liver here, these two anterior. You will note that this is divided in half by a piece of peritoneum that would come here called the falciform ligament. The falciform ligament would divide these 2 lobes in half. If I brighten things up just a little bit, you may be able to see falciform ligament just a little bit better on these models as I tilt it around, so you can see falciform ligament continuing on down. We will see that there is a coronary ligament up here that you do not need to discuss. You will see the vena cava on the superior portion and it descending down, and your left hepatic vein. But continuing on down, as we look to the posterior surface of the liver, that's associated here as we're looking at the superior inferior part of liver, and we're looking posterior here, and remind ourselves there are 4 lobes, and we can still see the left, and we can still see the right here. The other 2 lobes are found here, the caudate lobe, and here the quadrate lobe. Now, posteriorly on this one, you can see the gallbladder here next to the caudate lobe, to the quadrate lobe, gallbladder coming up through the common bile duct down. So if we trace this structure, we come from the common bile duct down, and we branch off one duct going in where bile is produced and going onto the body in the liver, and we come in. We reach the gallbladder. Now, if bile is not needed, we'll come back, regurge into the bile duct, back through the common bile duct into the gallbladder. We'll reach the gallbladder, and we hit here to the fundus of the gallbladder, as it would pass with the fundus of the gallbladder out here as we pass into the body. When we come to the duct, we would hit the neck, which would guard a sphincter coming into the body all the way to the fundus, farthest in from where it opens, the fundus out here, and together with the gallbladder. Now, one other structure that you will see here is the cystic duct. Cystic duct. Now, also you will see a bile duct continuing on here after the cystic duct. Now, one thing you want to note, this will not show the right and left hepatic ducts, but you will see the portal veins in here, the hepatic portal vein and the hepatic artery proper on these models. These are not structures you will need to know for the digestive system, but this can be useful in the circulatory system when you instruct with the liver. So the lobes, quadrate, caudate, right and left lobe of liver, gallbladder, fundus, body and neck, cystic duct coming here, and all these structures all head into an area known as the hilum. And on this model, that is about all we can see. We have a large liver model, which can be seen on our digestive tract models with our right and left lobes of liver. Here showing the ligamentum, the ligament coming here are the ligament that divides in half. So make sure you can find these structures. Our falciform in the middle. Now, when we come back down here, this model does a great job at depicting a ligament, which is actually not peritoneal attachment, but remnants of fetal blood circulation. In your book, it will call it the round ligament. In your structure sheet, it's called ligamentum teres. Ligamentum teres. It's a dried up piece of fetal blood circulation. On here you will see closer to the liver, on the back side, we can see our caudate lobe. Let's flip it around so we can see it up and down, superior and inferior. Caudate lobe, quadrate lobe. Gallbladder, its fundus, its body, and the neck, going to cystic duct, and a right and a left. So if we look at the duct that is going through to our liver here, the right and the left, the one that is nearest, the right hepatic duct, is nearest to the gallbladder, the left furthest away. And again, our hepatic arteries and veins, and caudate lobe, quadrate lobe, and the surfaces of the liver that can be seen. Diaphragm left intact here with its central tendon, and you will see the vena cava passing through, but not the left artery or the left vein, the left hepatic vein. Now also you will be able to see on this model, again, the right lobe of liver, the left lobe of liver, and you can see these fairly well. Gallbladder here. If we look posteriorly, we see the caudate lobe and the quadrate lobe. Again, ligamentum teres, gallbladder, its fundus, its body, its neck, and the cystic duct. The blood vessels that all pass here into the hilum of the liver. And also you will see the left hepatic vein. So these structures are all fairly visible on here. Not everything that we discuss here is actually responsible for the digestive system. Some of this stuff will become useful in the circulatory system as well in the future. So you may keep a hold of these videos and use them. Again, we can see falciform ligament. So all of these will show these structures pretty well. And that concludes my video discussing the liver models. And if I light it up a little bit more, again, you can see the falciform ligament separating the right and left lobes of the liver. And that concludes my video in discussing the liver, both the one that you can see in our torso models, the one on the complete gastrointestinal tract, and the teacher's model that we've been using in class as well. And these are the only livers in which you can get. These are at least that are removable and be able to be placed under the document cam. Others, in fact, you can see are attached to one of the major plaques of the gastrointestinal and respiratory tracts. And that concludes my video in discussing the liver. Please note that some of these structures are not on the structure sheet. Some of these structures are useful in the circulatory system. And there may be some extra things on there that we discussed that may not necessarily be on your structure sheets. But this concludes my video discussing the liver.